Hello, everybody. I'm Brett. I'm the Patient Information Support Manager at Kidney Wales, and my role is about working with patients and working across Wales to get the best for everybody. So tonight's session is in honour of World Kidney Day, and this year's theme is Living Well with Kidney Wales, kidney disease, not Kidney Wales, sorry. And we're holding this to let patients know and learn, because when patients get to hospital care, they tend to not really know the ins and outs and the basics of how the kidneys work and why certain medications are used. And so this evening we've got two speakers. We've got Susan Spence, who's filling in for Gail Williams, the lead nurse, and we've got Lee White, who's from the Swansea pharmacy team. Just some housekeeping. Please keep your microphones muted and your cameras off, only as the session's being recorded. And if you've got any questions, please type them in the chat option at the bottom. And we'll go ahead and get started. And I can introduce our first speaker. So Susan, if you want to turn your camera on.
Good evening, everybody. Yes, as Brett says, I'm Susan Spence. I'm the network manager for the Welsh Renal Clinical Network, and unfortunately I'm a bit of a poor substitute for Gail Williams, our lead nurse, who has something of the likes of 30 years of renal nursing experience, whereas I'm just a general nurse. So I'm going to make no apologies for pretty much reading Gail's presentation. I think it's important that I make sure that the information I'm giving is clinically accurate, and I'm going to give it as Gail would have intended. So Gail was asked to provide some basic information around kidney disease and some top tips in maintaining good kidney health, and finally the stages of the disease itself. Next slide, please. Thank you. So the topic that everyone is ignoring, and it's one of the main bylines of World Kidney Day, is that there's over 3 million people living with chronic kidney disease in the UK. This slide represents the number of people living with this disease in Wales, which, as you can see, is around 94,000 people. Next slide. So, some interesting and important facts about our wonderful kidneys and how essential they are to keep us healthy and well. The average size of a healthy kidney is 10 to 12 centimetres long, and they usually come in pairs. Kidneys are vital organs, which means you cannot survive without their function. However, you can survive with one healthy kidney. Kidney disease is often silent in its early stages with no obvious symptoms. and prompt diagnosis and treatment, as well as changes to diet and lifestyle, can help slow down or prevent further damage to kidneys. Next slide, please. So, what do the kidneys do? We already know that most people are born with 2 kidneys, but some are born with 1. And in fact, my eldest daughter was born with 1 kidney, and she's perfectly healthy. As you can survive with 1 healthy kidney. Hence, that's the reason that kidneys are donated for individuals clinically suitable for a live kidney transplant. And in this slide, I'll aim to describe the basic functions of the kidney, and Lee will later on present how the symptoms are managed, either by the GP or the renal specialist team. So healthy kidneys filter about 335 pints of blood each day. That is a lot of pints. The kidneys act as sieves, filtering waste and balancing any excess fluid from the blood. The waste and excess fluid is then transported and to the bladder in the form of urine. When kidneys are damaged, waste products and excess fluid will build up in the body. The kidneys also help to control the blood pressure. And whenever kidneys become damaged, blood pressure will increase. And that leads to an increased risk of stroke, heart disease, and also will cause further damage to the kidneys. Therefore, it's really important to keep monitoring and keep blood pressure under control. Healthy kidneys also produce a hormone called erythropoietin, which helps the blood marrow to make red blood cells. When kidneys are damaged, people can develop anemia. This is when there's not enough red blood cells in your blood. Another term for this is where your hemoglobin is low. And anemia can cause people to feel weak, cold, tired, and also short of breath. Healthy kidneys also maintain the correct balance between calcium and phosphate in the blood. When kidneys are damaged, the kidneys can't activate vitamin D, which can then lead to problems with bones. So they are very important organs in our body. Next slide, please. So, sorry, my screen has gone rather wonky, I do apologise. So, chronic disease in Wales, as we've already mentioned, CKD accounts for nearly 94,000 people in Wales. However, only a small proportion of those will go on to require renal replacement therapy. And what we mean by renal replacement therapy is kidney transplant or dialysis. And in Wales, only a small proportion of people with kidney disease go on to require that. And it's currently around 3,316 patients, of which 1,800 are living well with kidney transplants, 300 are currently on home dialysis, and around 1,200 patients receive their dialysis in a dialysis unit. Next slide, please. So who's at risk of developing kidney disease? Really, anybody can develop kidney disease, but there are a number of factors which increase the risk. Factors such as diabetes, high blood pressure, heart and circulatory disease, and a family history of kidney disease, or people who are from Black or Asian or minority ethnic backgrounds. The biggest cause of kidney failure is uncontrolled diabetes and blood pressure. Therefore, it's really important to monitor both your diabetes if you have it and your blood pressure, and to have those regular checks with your GP. Maintaining a healthy weight, keeping blood sugars and blood pressure in control can help slow down further damage and progression to needing renal replacement therapy. If you have any concerns, it really is important that you get in touch with your kidney team, if you have one, or with your GP. Next slide, please. So there are many things that you can do to improve and maintain kidney health. And here are Gail's 6 top tips. Tip 1, try and keep at a healthy weight. Be mindful how much salt is in food and avoid adding salt at the table. If in doubt, speak to your GP, kidney team, or dietitian. Tip 2, keep your blood sugars and blood pressure under control. This will help to reduce further damage to the kidneys and reduce the risk of stroke or heart attack. Tip 3, keep active. Whatever it may be, perhaps you may enjoy gardening, especially now with spring around the corner, or perhaps walking or cycling. The most important thing is just to keep moving in whichever way is suitable and comfortable for you. And tip 4, stop smoking. Smoking really does slow down the blood flow to the kidneys, causing damage. If you find it difficult to stop smoking, contact your GP, who will be able to signpost you to the right team to help and support you to give up. Tip 5. Around 60 to 70% of the body is actually made up of water, and every part of the body needs water to function properly. Dehydration can spoil normal bodily functions, including the kidney, and water helps the kidneys to make urine, and therefore keeping hydrated is important. However, for people receiving dialysis, they may need to restrict their fluid intake. Therefore, it's important to gain advice from your renal team and dietitian in regarding your personal needs for fluid intake. And lastly, but not least, seek advice from your GP or pharmacy teams around over-the-counter medications, as some, like Ibuprofen, can cause some harm to the kidneys. Next slide, please. So on to tests to diagnose kidney disease. The main test for kidney disease is a blood test. The blood test measures the level of waste product in your blood called creatinine. The waste product creatinine plus your age, size, gender, and ethnic group is calculated, and this is called an estimated glomerular filtration rate, or EGFR. I do apologise for tripping over that. EGFR. Urine tests are also done to check for any blood or protein called albumin. Along with the EGFR, urine can also help to give a more accurate picture of how well the kidneys are working. Other tests may include scans and a kidney biopsy. Next slide, please. So we've touched on the functions of the kidney, the risk factors associated to kidney disease, and some routine tests used to diagnose kidney disease. Next, we'll explore how these tests are used to identify damage to the kidneys. We've already said that one of the main jobs of the kidney is to filter waste products from the blood. Healthy kidneys should be able to filter at around 90 mils per minute or more. In other words, an EGFR of 90 or more. People may have kidney disease if their EGFR is lower than 90. It's worth noting that kidney teams may present kidney function information to you in different ways. The same information can be described as stages of kidney disease, the percentage of kidney function, or value of an EGFR. Next slide, please. For the first 3 stages of kidney disease, there is no specific symptoms. There is a slow decline in kidney function, and care is usually monitored by your GP. It might be worth noting that many people don't even know they have kidney disease at this stage, and often it's picked up by a routine blood test or admission to hospital for some other reason. Next slide, please. At stage 4, the kidney function is low. Usually people experience symptoms at this stage, and I'll show examples of kidney disease symptoms in the next slide. It's a really important stage to start planning ahead and making shared decisions about future kidney treatment in a timely way. At this stage, it's important to consider what is important to you, which kidney treatment will give you the best health, the most independence and freedom, and best quality of life as possible. Don't be afraid to ask lots of questions to your kidney teams. They are there to support you. Gail would also recommend speaking to patients with their lived experience too. So, for example, if you're interested in home dialysis, speak to someone who's already doing that treatment. They will provide so much support and lots of reassurance and encouragement. And this is the same for the other treatment options too. The whole renal team are there to support and help you choose the right treatment at the right time for you. Next slide, please. This slide represents symptoms experienced with advanced kidney disease. It's important to tell your kidney team if you're experiencing any of these symptoms. Treatment in the form of medicines or possibly dialysis can help manage or reduce the symptoms experienced. Next slide, please. So when kidney function declines further to stage 4, this is where the kidneys lose their ability to filter waste and remove fluid. At this stage, kidney treatments will be started. This is why at stage 4, the shared decision-making process is so important. If the planning is right, then the transition onto the treatment of choice will be controlled and safe with support from your kidney teams. Gail asked me to mention that she cannot underestimate the importance of the shared decision-making process, understanding what is important to you, the choices made, and a seamless transition for when treatment is needed. Next stage, please. Slide, please. This slide shows treatments available for kidney failure. So there are 3 main forms: kidney transplant, either living or deceased, dialysis, or conservative or supportive care. Supportive care is where it's around symptom management to maximise quality of life and to ensure your symptoms are properly controlled, but it's without interventions such as dialysis. Dialysis is available at home, which provides more freedom and independence in comparison to dialysis provided in a hospital or satellite unit. Next slide, please. So that ends the presentation. I hope I gave it justice, and I hope the information that was provided has been meaningful and useful. Thank you very much.
Thanks, Susan. And we're just changing over to Lee's presentation.
Well, good evening, everyone, and thank you very much for joining us on this World Kidney Day. It's a pleasure to come to talk to you this evening about all things kidney, but in this case, we want to talk to you about your medications. And thank you, Susan, for that excellent overview to start. I'm also joined tonight by my consultant pharmacist, Professor Chris Brown. So if you have any questions throughout, if you could put it in the chat and we can try and answer those at the end. Okay, so I'm Lee and I'm relatively new to kidney pharmacy myself. I've been a kidney pharmacist for the last 6 months and I'm sort of fascinated by how complicated the kidneys have been, but also how kidney services work very differently to other services in the pharmacy world. Next slide, please. So the talk this evening is about medicines, but it's also about engaging you, the patients, in your own kidney care and your medications. We really want to give you the tools and understanding to know more about your medicines and how we can work together in partnership to get the best care for you. Next slide, please. So wouldn't it be great if you could have a list of your medicines that's up to date and you knew what each of them did, but also blood results and understanding your blood results so you can make informed decisions about your treatment. In Southwest Wales, where I work and my colleagues work, we have been transforming services to try and enable this. And my next slide is a short video trying to explain how we've been developing our services to help you, the patient. This will soon hopefully be rolled out across Wales. So no matter where you are, you'll be able to get this service. Next slide, please. But as you can see, we look after a range of patients, whether it be patients that have chronic kidney disease or are on dialysis or are transplant patients. So why are medications so important? Now, there can be lots of different medications and we take them for various reasons. But for the kidneys, it's important we take our medications to prevent worsening or progression of the kidney disease. Kidney disease symptoms, which Susan has pointed out, may be some way into the progression of the disease itself. Also preventing further complications about kidney disease or other systems that can also be affected, such as the heart. And finally, it's to replace some of the functions of the kidney that's lost when you have chronic kidney disease. Next slide, please. However, we do need the kidneys, and when we don't have the kidneys, it can affect other medicines we take, such as painkillers or anti-epileptic medication. Kidneys are often the way that the drugs get excreted or got rid of from our body, and that's why the dose is unique to you and your kidney function. The example we have here down the bottom is might be a painkiller. So if you've got a very good, healthy, functioning kidney, you could be on a full dose, say 4 capsules a day. But as your kidney function declines, it may be that we need to reduce the dose or even change the medication to prevent the medicine becoming toxic in your system, as you can commonly become more sensitive to medications. Next slide, please. And it's complicated. It's complicated for me as a pharmacist, and I've been studying this for years. So we completely appreciate sometimes for the patient, it can also be very complicated. This is a little example of some of the medications that a patient on dialysis might have to take, but we can certainly break that down and understand why we're taking them. Next slide, please. So Susan's kindly gone through some of the stages of kidney disease, and I've also put it here for you. And I've color-coded it. So green might be the very early stages of kidney disease where you are experiencing no symptoms. And as you move on into amber, this and particularly stage 3B there on the left-hand side, this is where you might start getting symptoms and then come under the care of some of the renal specialist teams. And then moving down yet further to the red section, this is where we need to start thinking about renal replacement therapies, and you'll have a lot of intervention from the renal specialists. And linking this into your medication, in the early stages, it's likely that your GP will be looking after some of the complications of kidney disease, such as your blood pressure, which I'll come on to. And then as you progress, you'll get more input from the specialist teams, and you may even get some medications from the teams. And then finally, if you're on renal replacement therapy, such as dialysis, you'll get a lot of medications from us here in the hospital, and we'll be monitoring it very closely. Next slide, please. So we've gone through some of the golden rules for the early stages of kidney disease, but I just wanted to highlight 3 here that are particularly related to medicines. Next slide, please. So as we've said, some of the major risk factors for developing chronic kidney disease are high sugar levels, particularly uncontrolled sugar levels when you have diabetes, and also controlling your blood pressure. Controlling the sugar levels is really important because the kidneys, in the blood vessels within the kidneys, are really delicate and susceptible to damage with high sugar levels. And you can get proteins leaking into the urine, which is destroying the structure of the kidneys. And this is the same for blood pressure. It can damage the kidney itself, but you can also get other complications such as heart disease, and therefore the kidneys and the heart are linked with heart disease. Next slide, please. And the other thing to mention is medications that you can buy over the counter. There are lots of medicines you can buy over the counter, and they're not always appropriate for everyone. If we take Ibuprofen as an example, we know it's a really good pain reliever and anti-inflammatory medication, but it may not be right for you. Ibuprofen can damage the kidney, particularly if taken for long periods of time, by reducing the blood flow to the kidney. But it's important to have that discussion with either the pharmacist or your kidney team, or indeed your GP, to see if this medication is appropriate for you. Next slide, please. As I've said, the chronic kidney disease can progress, and it's typically stage 3B when you start getting symptoms and you start getting specialist teams involved. I've highlighted here 2 common areas of chronic kidney disease, which I'll go into in more detail, but there are many others. So anemia is one, and mineral bone disease is another. Next slide, please. So anemia. So what is anemia? And what do you feel like when you have anemia? Well, Susan's kindly said when you have anemia, you may feel tired, lethargic, cold. And anemia is a reduction in your body's ability to create red blood cells. Now, why are the kidneys involved in your ability to make red blood cells? Well, iron, which is a building block for a component of the red blood cells, when you have chronic kidney disease, it is an inflammatory condition, which means that you absorb less iron from your diet in your gut. And therefore, you don't have as much of the building blocks to be able to create the red blood cells. Typically, to start with, your GP may prescribe a tablet form of iron, but as your disease progresses and you become more anemic, sometimes we have to give an infusion into your veins of iron. And this may be once or twice a year, but it can become a lot more frequent if needed. And we need to keep a really close eye on your iron levels and your blood counts. And we measure the level of anemia by something called hemoglobin, which is how you carry oxygen around your body. And you'll be given those targets by your specialist teams. Next slide, please. Oh, sorry, one slide back. Thank you. The second part of the anemia story is the signal that comes from your kidneys to tell your body to produce more red blood cells. Your kidneys produce a hormone, which is quite hard to pronounce, called erythropoietin, but we simply call it EPO for short. As your kidney function declines, your ability to produce this signal also declines, and therefore we have to supplement this in our treatment. So the first stage is to make sure you've got enough iron and you're able to transport it. But the second stage is to supplement the erythropoietin, or EPO. And EPO are typically injections given at varying frequencies. They can range from being once a month to other types that are given weekly or even multiple times a week. And we need to closely monitor this, and these medications typically come from your renal team. Next slide, please. And the second big part of the story is mineral bone disease. And as it suggests, it involves the bones and it involves minerals. But why, again, is the kidney involved in your bone strength? It doesn't really make sense. But one of the main components of bones are calcium, and I'll come on to another component a little bit later on. Vitamin D is a big player in this. So we need vitamin D to get calcium into our bones. And as we know, we get vitamin D from sunlight, but we need to activate vitamin D, and this is the role of the kidney. When our kidney function declines, we need to give you a form of vitamin D that your body can use. And this is a little red capsule called alpha calcidol, but basically it's an activated form of vitamin D. As you can see from the X-ray down in the bottom right-hand corner, when our bones are weaker from chronic kidney disease, we're at a greater risk of fractures or changes in the bone, which shouldn't really happen. Next slide, please. And I said the other big player in, or the other big component of bone is something called phosphate, which is found in our diet. Our kidneys normally get rid of phosphate or excess phosphate that we don't need. But as our kidney function declines, our ability to get rid of enough diminishes also. And this is also the case when you're on dialysis. In some circumstances, the dialysis machine can't get rid of enough phosphate. The trouble with phosphate is if it's too high in your system, it can form with calcium to create bone in your circulation and also in your joints. And so we can see from the X-rays again in the bottom right-hand corner, calcification or hardening of areas which shouldn't be calcified. The way in which we control phosphate levels is firstly by controlling phosphate intake in your diet, which is commonly found in meats and dairy, but more so in processed foods as a preservative. We control phosphate levels by medications in the form of tablets or sachets, and these are phosphate binders which need to be taken with food. And they're very individualized, so depending on your diet and depending on lots of different factors, we may work with you to give you phosphate binders to take. And that's one of my roles as a pharmacist on the dialysis units, is going around the patients and discussing their diet with the dietitian, and also finding the best balance of phosphate binders to take to control mineral bone disease. Next slide, please. Okay, so we've talked about the progression from your GP looking after your medications, and then as your kidney disease progresses, specialists getting involved. And then at the end, towards stage 5 or kidney failure, we need to start thinking about renal replacement therapy or dialysis. Once it gets to this stage, specialists and especially kidney doctors, nurses, pharmacists and dietitians are really involved in dialysis and all of the different medications needed to make that happen. I'm not really going to run through them, but there are medications we need to use to allow the machines to work. And you may also get some of the medications you had previously given to you on dialysis. Next slide, please. So take a bit of a breather. So how do we deal with all of these medications? I've gone through a small amount of the medicines, but as you move through the progression, they become additive and the list can become quite long. So The way in which we deal with it is keeping all of the information on a single digital system. And we have your medications alongside your blood results and your medical notes. And this gives us the ability to effectively update your GP, but also, and as I'll come on to, a way of you being able to see exactly what we can see. And we can look after your medicines wherever you are, because we talked about the large regional areas of Wales, and I'm sat in Swansea, but I can equally look at someone's medications and help them if they're in Carmarthen or Withybush or Aberystwyth. And in the bottom right-hand corner is one of our colleagues, Dav, claim to fame. He's our specialist renal pharmacy technician, giving out medication. Next slide, please. If you're not too digitally savvy, that's absolutely fine. We have methods in which to give you lists of your medications in a printable version, which is taken directly from our system, so it's correct in real time. And also we have information for you to be able to contact us by many different means, so telephone, email, and as I'll come on to, PatientView. Next slide, please. So what is PatientView? So PatientView is the way in which you can tap into your medication lists and your blood results, and this gives you the power to be able to manage your own medications and also work with us to get the best out of your care. I've put a link to PatientView there, and as you can see from this screenshot, the top right hand corner, you can have the ability to sign up and get a login and start the ball rolling, really. Next slide, please. So I've got a little example for you, and it links back to my work with patients looking after their mineral bone disease, their phosphate levels, and their phosphate binding medication. And on the left-hand side is just an example that you can get PatientView both on your computer, but also your mobile phone in an app. An example is lanthanum, which is a phosphate binder, which is a chewable tablet, which was prescribed 3 times a day to be taken with the main meals. And then Renacet, which again is a solid tablet, 1 to be taken 3 times a day with snacks. And say we then find that our diet has changed slightly and we're eating a bit more meat or we're drinking a bit more milk, and we have a look at our PatientView and our phosphate level. And the little graph on the right-hand side shows that our phosphate level has gone up. And you remember talking to your pharmacist or nurse or doctor, and they've said, if your phosphate level goes above 2, for instance, you need to take a little bit more of your phosphate binder with snacks, for instance. And what you can do then is, after a discussion or a predetermined prescription, you can say, okay, my phosphate level is high and I need to take a little bit more of my phosphate binder. And so this is where the prescription can get changed, and you can carry on taking your lanthanum, but increase your Renacet up to 2 tablets 3 times a day with snacks. So I'm hoping that's a little example of you being involved with your results and your medication and your clinician. Next slide, please. So coming on to some of my final slides now. So we're thinking about how we can modernize the way we do things for our modern day healthcare and engage and involve you, and so you can be the expert in your own care. So currently we are creating digital education material in the form of animations and cartoons. So we doing them on various topics, and the aim is to make them available on a website, so you'll be able to see them at your own in your own time. But it may also come to, once you collect your medications, you'll be able to scan a little code and it will take you straight to those videos, which I think would be really good to help get people involved in their medicines. And the other two really are for clinicians themselves. So shared renal care summaries will be for other doctors and nurses and other healthcare professionals to be able to see what's happening with your kidney care up to date and at any stage. So, for instance, if you came into hospital, into A&E, they would be able to see what's been happening with your kidneys and your kidney doctors straight away. And then finally, in terms of digital surveillance of your kidney disease. So we talked about you don't really get symptoms until quite late on into the progression of your kidney disease. Well, this will be a program to alert, and it is working already, a program to alert your GP that your kidney function is declining. And so we can try and capture that at an earlier stage to try and prevent the progression. Next slide, please. So that's the end of my medication talk. There's an awful lot to go through there, but I just wanted to share this with you. It's data that's a week old, but the information trickles through. But it just shows the uptake of the COVID-19 vaccination in Wales. And as you can see by some of the figures there, it's a really, really good uptake. It's likely to be slightly better than that. But we're encouraging patients to have the discussion and hopefully have the COVID vaccine, whether it be with their GP or in centre. Next slide, please. So medications are really complicated, and well, I find them very interesting, but not everyone does. But if I've lost you, I've got some funny little points here. So kidneys are amazing. They're really complicated and they do many, many things. We definitely need to look after them. And when they no longer work, we have medicines that we need to take to try and help them or help what they do. There may be many medications, there may be just a few, and the doses are unique to you. You can be the expert in your medicines and understanding your medicines and your blood results, but we are always here to help you with this. Next slide, please. So a very, very happy World Kidney Day, and thank you very much for listening. I think we'll go on to questions.
Thanks for that, Lee. And I just want to introduce Judith Stone, our Managing Director at Kidney Wales, for questions.
Hi everyone. Thank you so much, Susan and Lee, for those really informative presentations, and also to people who were involved in the webinar who submitted questions in the chat pane. So some of those questions are quite specific, so I've replied to you privately, but there are a couple that we wanted to pick up and ask the questions to the panel. So there's quite an interesting one there, a point that's come up from Peter, who's a patient in Mid Wales, who is explaining that in Mid Wales, PatientView is not available and a different system is used by that health board that covers Mid Wales. So this is a question for Chris, really. Is PatientView available for all patients across Wales, or are there plans to make it available in the future?
Yeah, thank you. So PatientView is available to patients outside of Wales across the UK. It's a well-established platform that you can access your blood results and your medicines list if it's supported by your kidney services. Obviously, you need a digital system that supports that, and currently, as Lee's alluded to, there's some some exciting developments that are happening digitally, where we're looking to create a one-wheel system that allows us to have far more functionality, and that will feed into a better experience for those accessing PatientView. So we know currently you can access medicines that are put on there by your renal unit, and typically these are medicines that we may administer you if you're on dialysis, or that we may supply you. And there are certain regions that also include the medicines that come from your GP. And what we want to do is, like Lee said, is for people to be empowered in working with their professionals to become experts in their medicines and their blood results, and having this information at your fingertips, so that you can be active partners in your own care and have informed information to have these discussions. And what we want to do with platforms such as PatientView, like Lee said, is start creating animations. When we start someone on, say, a phosphate binder, for example, it's quite complicated. Often we have to give these messages time and time again, and it may be that you have not really understood that at the time. So, like Lee said, scanning a code that takes you to a phosphate binder video, it explains to you about how that relates to diet and medicines and dialysis and all these sorts of things, and that really then gives you bespoke information that's been produced, by kidney experts in Wales, that will allow you to learn more about your condition and your medicine. So it's quite an exciting program, and halfway through this year we hope to launch a specific website which will host all these animations and allow you to become more active partners in what you do.
Fantastic, thank you, Chris. So it sounds like you and the team in Morriston are leading some really exciting digital developments there. What other things are you doing in terms of digitising services for patients?
So we've a concept which was created in Southwest Wales, across Swansea and the Hywel Dda region, is taking paper away from the way that we do services for dialysis. So, for example, in the Swansea region, each week, just to give people dialysis, we have to administer 6,000 medicines, and those are bespoke to individuals. We look at 3,000 blood tests a week to tinker with those doses and make sure that the EPO that Lee describes is the right dose for you at that right time. And that's a huge geography. So being able to do this digitally means that we can speed up the response to blood tests and get things done quickly. And COVID has really shown us, why we need a service like this, that we can tailor people's treatments regardless of where we are, reducing movement. And so what we've developed with our nurses is touchscreen technology and digitized our paper-based systems. So those prescriptions that required me to drive to Carmarthen and write prescriptions no longer need to happen. It can be done digitally, and those are instantly available to the nurses. So they all have their own laptop with their carts. They can interact with the digital prescription. It means that if there's a problem, they can ring me and I can get those instantly changed. It also means that we capture a lot of data, which means that nurses are provided with dashboards, for example, that says there's, of the 300 drugs that you're due to give this morning, 3 of them still haven't been given, and it prompts the nurse to go and do that. So a clever digital surveillance systems that helps the nurse do less paperwork and less bureaucracy, and spends more time at the patient bedside with all the information they need at their fingertips. And we've been lucky enough to work with the Renal network to expand this across Wales. And over recent months, we've been up in North Wales, where we've introduced this technology to all the dialysis units in North Wales. Now they're fully covered. And over the coming months, we'll be doing that in Cardiff. So there's a series of things that we're building and existing platforms on to make sure that all Wales is covered by these services. And that should allow patients to access services easier, access information better. But also it means that we as clinicians spend less time on old-fashioned paperwork ways of doing things, taking away some of the bureaucracy out of the system and giving us the opportunity to spend more time with patients and more time at the dialysis station, for example, or even doing virtual consultations where that may be appropriate.
Lovely, thank you very much, Chris. I'm just conscious of time now, and we do have at least one more question from Edgar in the chat pane there, which I'll come to in a second. But if any of the other participants have questions, please put them in the chat pane now, and if there's time, we will come to those. There's a question there which I'm going to put to Brett, which is from Edgar, who is having a fistula operation next month, and he is understandably very apprehensive about it. Can you talk through what he might expect, Brett?
Yeah, you'll be really well looked after when you do get it. The fistula is where they join the artery and a vein together, and it's done under local anaesthetic. It's done in a day surgery. It's not abrasive. It's not really bad at all. It's it's not a nice service, but yeah, you're well looked after. And after you've had it done, you will be a wee bit sore in your arm for a couple of days because they have been in with knives. But once you heal up, you will start to feel a buzz or a frill. But that frill basically shows that the fistula is working. As for myself, I can put my hand on my upper arm and I can feel it. And that to me is a really good sign, because it means my fistula is definitely working. And it means I'll be able to get my dialysis.
Fantastic, thank you, Brett. So there are no further questions in the chat pane now, so I'll just hand over to you to close the conference, Brett. Thank you.
Yep, no worries. Thank you for joining us tonight. We're going to be sending some links of the recording of this evening that'll be available afterwards, and also if you could fill out an evaluation that'll be coming from you. In the meantime, if you haven't already done so, then please sign up to hear from us from doing it via our website or joining our closed kidney community group on Facebook. If you have any questions that are a bit more specific, then please contact myself on brett@kidneywales.cymru. And if there's some things you would like to do to sort of get involved, we are doing our tea parties, and you could actually host yourself a tea party, get in contact with us, and we can send you out the pack. And it's a really good opportunity to do a small fundraiser. And even if you're not fundraising, actually just doing something to basically be sociable and have a sit and a chat and a cup of tea, a biscuit, a bit of cake. And other thing that we've started, was launched today, is a Tithe Draws company. So a walk around Wales, and you can sign up for that. It's a year-long fundraising that we're doing, and it covers 531 miles, and that's basically distance between all dialysis units, the 18 dialysis units across Wales. And you can either do it individually or you can do it as a group and spread the miles across. So if you want to get in contact with Team at Kidney Wales or speak to us on Facebook, we can sort that out. And I just want to thank the speakers, and thank you for this evening.